Mondli Mvambi, the spokesperson for the Free State Department of Health.
So, Mondli, following the conversation me and you had on the phone about the allegations towards the hospital, you then brought the DG to come and have a chat with the staff. We also spoke to you, and we also spoke to some of the staff members. What is the situation now?
Well, the DG came as a result of seeing the media reports over the weekend about what is alleged to be happening at the hospital here. DG Dr. Buthelezi came with Dr. Ncha. Dr. Ncha is responsible for the provincial health facilities. That is, she looks after the performance of the health facilities and their perception of service delivery uptake. The interesting thing that has happened since this morning, we allowed the hospital to provide a scenario of how they are providing services, but also as a province we provided the history from where the CEO came into this hospital, what has been happening with all the challenges that the CEO has been experiencing. The DG will then take the report to the minister, because this is also assignment of the minister, because the minister is the Minister of Health, as you would know, acts on the basis of the interest of the public, just to make sure that there's never negative perception about health facilities not providing services.
I missed it. How does the Minister of Health get involved? Does the minister call the DG?
Well, the Minister of Health, upon seeing these things, discussing with the DG over the weekend, because they do media monitoring and they interact with MECs in the provinces about what is happening in their provinces, because the interest is make sure that whatever happens, the best interest of the patients are never compromised. Now, this meeting happened today, and we have heard what the service delivery landscape of the hospital is, and the DG will be taking the report to the minister. But what is of interest, which I need to report to this, is this hospital, as I've said during the week, the location of the hospital, it's a serious problem in the context of its enlarged catchment area, with people, the areas here have grown in comparison to the staff profiling of the hospitals. Now, as much as you may be having enough doctors, we have identified that we need to increase the number of allocation of the nursing staff, which are the backbone of the healthcare system. And the province, to a better part, has been doing whatever it can to the best of its ability, but it would need to engage to increase the capacity levels when it comes to staff. But when it comes to the video that was widely circulated, we also received the report.
Do you agree now that the video is not fake, or do you still believe that
No, the video has never been fake, but the context of the video has always been...
So you feel that the context of the video was done maliciously?
Not necessarily, but the context of it is, who are those people? Because the perception was, these are people who have come to the hospital, who are neglected, not given services of the hospital where they need the services, only to find these people are people that are transported from the hospital here as a waiting base by EMS planned patient transport to Boitumelo Hospital in Kroonstad, and others pick up to Bloemfontein for tertiary, because this is a district hospital and it provides services to a limited extent in terms of its own competence. But complicated cases, as you would know, or long-term specialist referrals are taken to Bloemfontein. So these are the people sometimes who are scheduled to come and be picked up here, but because of issues of safety and security, they come earlier to the hospital. They end up sleeping here, some of them, just to make sure that they are not subjected to mugging in the community as they are coming to be picked up by the planned patient transport. Now they sleep here. Now the important decision that has been taken about that, it's something that the province has been considering for quite some time, making sure that we look at the bed utilization utilization rate of the hospital, and this bed utilization rate of this hospital is about 70%. Now, you need to plan to put these patients in a particular safe area where they can be safely accommodated overnight whilst they are awaiting the planned patient transport, which is going to be taking them from here to Kroonstad or Bloemfontein. I think this is a major breakthrough issue that we are announcing, which is something that we've been considering for quite some time as a province. Because what we are saying as a province is that in the eyes of the public, it doesn't matter. When a person is sitting there in a hospital premise, that person is neither EMS nor the person of the hospital nor the person to be transported by planned patient transport, but that becomes a patient of the Department of Health, and all of them equitably will need to dispense equal amount of care in the manner in which they are receiving services. Because if in the eyes of the public, if they don't receive services in a particular way and you don't care about them, or you turn a blind eye, the perception would be the department is in neglect. So that is what we are going to be doing, and coincidentally the district, because the district manager was here as well, the district has a planned meeting, I think it is on Wednesday, where they are going to be looking at the basket of care of services, where they are going to be instituting things like that as to how do they strengthen lower levels of care clinics, because clinics here have doctors during the day, but you need to extend operating hours, because some of the people that me and you saw in the morning
said that she was at the clinic, she was referred and then back
yes, we need to be able to manage that communication between the health facilities, so that a patient is not thrown or by perception thrown from pillar to post, because that person may be lost to the system, or how do we build confidence to our people, because at some point some of them felt that clinics did not have doctors, and doctors are only at hospitals. Now, for me to be seen to be treated well, I must go to the hospital where I'm going to be seen by a doctor. But our clinics have doctors, and they are direct linked to their level of care. They are primary health or public health specialists at primary health care level, and they are able to treat them. So what we need to do is to strengthen that level of care, but also look at extended hours of the clinics, maybe from 7 o'clock in the morning to 7 o'clock in the evening, or even have one facility that can provide 24 hours services in the area, so that your primary health care cases don't overflow into the district health specialist area. Because if a person with a headache, running tummy, or what is classified as your P3 levels, which are primary healthcare illnesses, is here earlier, and somebody comes, or many more other people come after that person in the emergency cases, this person is likely to wait a little more longer than anticipated, and for them that waiting longer becomes an irritation and a perception of neglect. Me and you were here, we were talking to one patient who says I have not been seen, but when we took that patient down memory lane from the time they arrived here up until the time we're talking to, we discovered that this person has been seen, this person has been traced, this person has been given some is some time to be seen by a doctor who is busy seeing other patients at the moment. That person perceives themselves as not been seen. I've seen one old man here as well who says I know what is supposed to happen in the hospital. I have been here and I have not been seen. But when you ask the patient, because the old man happened to be an escort of the patient who has come here, when you ask the patient tells you, no, the doctor did come see me, the doctor did check me, and the doctor has told me that I will be seen. They're still busy with other people. Now, the other thing that we need to improve is communication with those patients that are awaiting care. Because when you are too busy and you are not looking at them, they don't care that you are busy looking at other people. The fact that you have not come to them, or you have taken so many hours not reaching them, to them that's neglect. and you can't blame them. So we need to be able to reach out to them so that we sanitize our levels of good relations between patient, the clinical staff, motivate the cleaning staff as well to keep the place clean, because the place is clean. But I've just spotted a few things in the casualty area which needs to be looked at now and again, because patients come and
the issue of the smell there was a point to it, but it needs to be looked at.
There was no smell. There's no smell in the
but dirt, there was some level of,
like paper dropping. People they are eating.
There's a lot of people there.
They are through,
so
yes,
there must
over
be a
time. Consciousness of quick turnarounds of frequent cleaning in the areas that are inhabited by people, because really the waiting area in the casualty is the only place where there was little dirt on the floor. But when you look entirely over the hospital is pristinely clean. The issue of the food, we must emphasize, the food here is provided by a contract service which is carefully monitored to make sure that that contract performs. Because the reason why out of a competitive bidding process, the contract was entered into was to circumvent previous problems of allegations of food shortages and bad quality of food, and that was entered into this contract to circumvent those things. And that contract, ever since it has been in place, has been performing well. Now you know the issues of supply chain and all those, it's issues that will be sorted out over time, because you need ethical leadership in the facility. The issue of complainants from outside, there's a complaints management procedure in the hospital.
Quite upset with the two candidates that
who are not just members of the community. They are not members, ordinary members of the community. They are business people
so you're
around
accusing
here.
them of being business people with vested interests.
They are business people around here, and we don't think that they should have spoken in the manner that they spoke, because we are still contending even now. If you say there's been death of patients whilst waiting on the queue, where are the complaints about that? Because we don't think anybody can leave that lying. We need the names of those people that allegedly died whilst awaiting to be assisted. Because to us, death of one person is not by the way. It's a matter of, we pride ourselves with zero death in this facility of people that we are assisting. We want to improve on that and make sure that, to the best of our ability, we never lose a patient who has already
died in this facility this year.
Well, I haven't checked that, but you know, patient dying whilst waiting to be receiving services, as alleged in that interview, that has not happened, and we are still waiting to receive that information so that we can clarify it and be able to attend to our weaknesses, because we are not arrogant as a public health facility. We are open to continuous improvement, and where we are perceived to be failing by members of the public whom we serve, we need to be able to go to those areas where we fall short and improve on those to make sure that they receive quality services.
Sorry, did the video that was broadcasted make you angry?
No, it did not make me angry. It concerned me because, one, it violates the privacy of the individuals, because we wonder if those people, but it also assisted us because we are now increasingly aware of the need to attend to certain things, and we are attending to those things. We prefer that such things, when they are done, so that they don't violate the confidentiality of patients, because somebody who's sitting there might not want to be known that they are attending to healthcare facilities like this, because, you know, people have got different ailments, and there's things like stigma in our communities. But we've got a complaints management procedure in the health facilities where we think that people need to follow that procedure have confidence in that procedure, so that we are also held accountable as a health facilities to be able to attend to each and every case of any person who complains, and be able to close the complaints as they are registered with us, and we've been able to attend to them.
In your investigation, you obviously then came on the Saturday because you saw this video, right?
No, I did not come on a Saturday. I came on a Saturday because some I think now 5 weeks ago there was an allegation on the so I think it's Metsimaholo concerned group, something like that. I saw Facebook that group. Yes, I saw something like 2 patients died whilst they were on the queue, and I came to the facility to just come and see how are services being provided in the facility. And when I got here, yes, there were issues with the nursing category in particular. The doctors were on duty. The rostered doctors were attending to their responsibilities. But doctors on duty without adequate nursing, they feel a little bit more burnout, because then they have to do a little bit extra than they are supposed to do, which the department is attending to. So I needed to see what is happening. Cleanliness, issues of food, issues of security, issues of the general upkeep of the hospital. And I was not sent by anybody to do so, except that I did get permission from the MEC and the HOD to be able to do that, because from time to time we move around the health facilities in the Free State to check provision of quality healthcare services. Is it happening? Is it happening frequently? Are there complaints? What is it that we can do to improve continuously the provision of healthcare services in the province? You
spoke about ethical leadership,
yes,
and management here. What now has happened to the CEO's case? The last we spoke, the complaint against him had been investigated, and it was at the HOD level.
Yes.
What's the next step forward?
Well, the report, as I said to you,
was it also something that you discussed in your meeting?
Yes, it was tabled here. The report has been completed, finalized. All the people that are supposed to have done their part, they've done their part, and those that did not play their part, I don't want to mention people by names so far, up until the report is tabled. The HOD will then preside over the report. It will be published in terms of its content, and we will take it from there. As I said, the content of the report is not something that I'm at liberty to talk about up until the sign off, because if it's not signed off, it's not official as yet. But
was the CEO in this meeting?
The CEO, yes, was in this meeting.
The CEO is back at work.
The CEO has been back at work from the time his precautionary redeployment to the district was done, because the CEO was never suspended.
Which is what you said.
When there were issues around him, you investigate the issues, but you want to take the individual consent out of the environment, so that you put them in an environment where they are not going to be perceived to be interfering with the investigation. So that investigation happened, done. The report is completed now, and the CEO had to come back to the facility. He is here in the facility and is presiding over the facility.
I think might be my last question. So, in your complaint to the SABC, you said that the 2 gentlemen that we spoke to were hired guns to peddle a specific narrative that paints the hospital in a bad light, that has paints the CEO in a bad light, because they have vested interests, because they are business people. This is what you said. Am I right? In your complaint?
Yes, that's my complaint, because I am saying what is the if you are a complainant, what is your relationship with the complaint in the facility? Why is your complaint coinciding with the arrival of the SABC, which I believe has no relationship with you? But they happen. You are a high profile person around, and you happen to be in the space. Why the coincidence?
I understand your that suspicion. What I don't understand is why then did we have 2 people, one who spoke to me and you,
It's quite interesting.
And another one who was also another person who echoed the same complaints that the two gentlemen echoed.
Quite interesting coincidence.
So
which
people all are saying the same thing about concerns about the hospital.
Well, as I have said, all the other complaints are noted, and as I have come to you, I have reported on the things that are going to be corrected to strengthen healthcare services, which are, by the way, the majority of people around here are receiving quality healthcare services from this hospital. They are not going to private. They are not going because some of them can't even afford to go to private. Those who are here, they are receiving the services here. So it is in our best interest to make sure that the services are continuous quality as they have been before. We see people from cross-border outside the province coming to receive healthcare services here, which is to us, instead of complaining, we pride ourselves that our services are not only good for the people in our part of the province, they are also good for people outside the province, in the neighboring provinces. So it's something that we need to be priding ourselves on.
So today's complaints are valid, but the complaints that we got from the two gentlemen are not valid.
Look, in a hospital environment, there will always be complaints about long waiting times, because, as I've said, there are cases that are not hospital cases, district hospital cases. They are clinic cases, and there are many of these cases that believe that by coming to a hospital, we will receive good help on time there. And the more they come, they are clogging the system, and they end up waiting longer instead of going to the clinics where they are awaited and they are likely to be helped much more faster, because we have strengthened healthcare services here with doctors in the primary healthcare space. And we want to encourage people, please take good care of your health, one, so that you are not falling sick unnecessarily. Two, when you are sick or you think you are likely to be sick, consult healthcare provision at the hospital as early as you can, so that you are diagnosed early and you are treated early. But if you are sick, be referred by a clinic to the hospital instead of you self-referral, because you may not, your illness may not be an emergency case. I met a person here with a swollen thumb. It's a hospital. It's a clinic case. It's infection on the thumb. That person is a clinic case, but they are here waiting to be assisted. And how many of them are then clogging the system in that way? And if they are not helped, they are going to be complaining. So those two, I'm saying anybody can complain, but it's interesting. What is your relationship with? I don't know them. No, I'm saying them. I'm not saying you per se. I'm saying if you are complaining, what is your relationship with these people that you are complaining about? Are you going around touting people, to collecting a list of complaints in order for you to bring
also,
them? And coincidentally,
between you and them.
No, there's no personal issue. There's no personal issue.
So
I am just saying,
you know that they're touting.
No, I'm saying to me the coincidence is quite interesting. That
maybe I'm
on the day.
I don't understand what it is that you're suspecting about that.
On the day, I'm saying the SABC. I believe that the SABC has no relationship with those people.
Yeah, we don't know them.
And when the SABC came to the hospital, those people would not have known that the SABC is coming to the hospital. But interestingly, these two people that you interviewed, who do not have a direct relationship with patients that were at the hospital, suffering from long waiting times, happened to be the ones that are on TV complaining about the healthcare services of the hospital. What a coincidence.
I see.
Yes, but be that as it may, we are committed to making sure that quality services are provided all the time to the people in the hospital, irrespective of who they are. And we encourage people that are coming to the hospital to follow our complaints management procedure, so that we can be able to capture those. And if this happened to be in the media space, we do not have a problem to be responsive, like we were responsive from the time when we received the complaints as it is.
Yeah.
And that video was an unfortunate misinterpretation of who the caliber of the patients are. These patients happened to be the patients that were sleeping overnight in the hospital en route to a planned patient transport outside this hospital. These were not patients of this hospital.
Have you since had a chance to get a hold of the person who shot the video?
No.
To have a chat with them about what just like you managed to with the lady that we spoke to now, and you spoke and you found out what was going on, so you were able to clarify.
Yes.
Have you since had a chance to get a hold of that person?
Yes.
And to clarify to them what the situation was?
No, we are making follow up to that. We will trace it because we did not want to be reactive as if we've got a personal vendetta against the person. We had to deal. I mean, we've got our own limitations dealing with province-wide issues on a daily basis. We will be following up as we are supporting this facility. We are following up on issues like that, just to make sure that we redress. We are not being defensive. We redress. Our interest is to redress, to make sure that quality healthcare services are provided to people all the time.
Final before the guy asks you a question. So at the end of everything, right, after all your meetings and everything, what message do you want us to take away? What does that make sense? What I'm saying? What is the message that you want us to take away? You said you dealt with this, that, and the other thing, but what is the message that you want us to take away from everything that has happened and the interventions that you're trying to put in place?
Well, media coverage in South Africa must be contextualized and properly contextualized. We, as the Department of Health Communication System, were available to the media to exchange and give things a proper and not being defensive. Importantly to us, it is that the issue of strengthening of primary health care is an important issue. The issue of strengthening district healthcare service provision is an important issue. But most importantly is the understanding of people out there about the functioning of the healthcare system, and for them to have confidence in the levels of care that they are placed in, so that people don't find themselves in a wrong place because they are aggrieved about any level of care, which means that people must not avoid a clinic because of a perception that they are not going to be helped in a clinic, and they will be helped in a higher level of care, because that is making difficult for the healthcare services to work optimally. We want to send that message, and to the nurses and doctors. We appreciate their dedicated work that they are providing, and all in clinical settings, like your cleaners, your security personnel, the porters, the people that are cooking, all those people are important in the value chain of healthcare services. And the commitment of the Free State Department of Health is to make sure that healthcare service provision in the Free State happens in the right way, and it's received by the right people at the right places.
I think maybe just to speak to the efficiency of the clinics, right? There was previously a case where a clinic in the township, Chegwavara, which did not have water and had to be closed down. Don't you think some of these issues are where people are coming here, they're not confident enough that they will get help from the clinics, or maybe the clinics are closed at the current moment?
Well, we are doing our best to do what is called intergovernmental relations, to make sure that all those at any other sphere of government, they are able to assist us as healthcare services to be able to do our own things. For instance, water is not our competency; it's a competence of the municipality, and we need their assistance to make sure that because water is important for infection prevention and control in healthcare settings. So if water is not there, it's inevitable we will have to close if we don't have any alternative water source. In many other health facilities throughout the province of the Free State, we are finding boreholes to make sure that those individual institutions become self-sustainable in terms of water provision. But the issue of boreholes is not a lifetime solution, because South Africa is a water scarce region, and to just keep on drilling boreholes everywhere may not be a long-term sustainable solution. But we are saying let's use water sparingly as people, but also let those who are responsible for provision of healthcare services, other services that can assist us as healthcare, let them do it. Roads, the same, any other public infrastructure. Now, we bear the brunt most of the time because of these others that are not doing their job, and we're encouraging them to do their job. But the fact that the hospital had to be closed, and a clinic had to be closed, and people had to be brought here, and they were assisted because people are not being turned back. I have not heard a complaint that says we were transferred to that hospital and we were turned back and not assisted. I haven't heard that. They may not be assisted, they may not be satisfied sometimes about the extent to which they were helped, but they were helped. I think that's something to take home, but we must avoid such situations so that we don't overload those that are supposed to be doing their work and who are already doing their work.
Can you confidently stand here and say that the Free State Department of Health is doing a great job to make sure that the services are rendered to the people of the Free State?
Oh yes, health is an emotive issue, and it's dealing with human physiology and anatomy. It's a complicated issue, and doctors, knowledgeable as they may be, they are also subject to committing mistakes. We need to be careful as to how we manage those mistakes. Those mistakes are the negligence born out of lack of knowledge, out of lack of competence, and we deal with those things through the relevant clinical processes. We then need to look at each and every case in its own merit. We cannot generalize about situations, and I don't want to stand here and blanketly defend health that we are zero defect. No, we are not zero defect, but we do our level best to make sure that we minimize the extent to which any medical negligence may happen in healthcare facilities. And where such happens, there are ameliorative, corrective measures that can be taken to make sure that those patients are treated with care, because our confidence is in seeing patients coming ill and walking out, healthy and strong and being productive members of society. That's what we want to pride ourselves with.
But the Minister of Health is watching this.
The Minister of Health, yes, is watching this, and this is what he is always holding us accountable to. The MEC of Health, Mema Tabolieto, whenever she comes back from the National Health Council meetings, she comes back with a report that says we have presented our status, state of health in the province as it is, and we are being monitored. And the minister, we don't know what mechanisms are they doing to independently verify what we say we are doing. But most of the time,
as Ngubeni and as Free State Health Department, you are taking ownership of the situation and trying to correct it.
The situation here is good. There was a glitch of a perception of patients that were neglected on the floor, and that's what we are correcting by making sure that here and elsewhere patients are not seen to be lying on the floors and neglected. Whether they are patients of the hospital or not, we want to make sure that in the value chain of care, we are good at every level. Because for us, a patient is a patient, irrespective of the level of care they are in.